Good morning and welcome to today's webinar, Parent and Guardian Mental Health. Today's training is being offered by the Behavioral Health Quality Department. Today's training will be led by Dr. Kimberly Canfield and Heather Martinez, RN. If you have questions for the presenters, there will be time at the end for questions. Please type your questions in the Q&A box. All right, Dr. Canfield, take it away.
Thank you, Christy. Good morning. Thank you for being here, and more importantly, thank you for the work you do every day to care for others. My name is Kimberly Canfield. I'm a pediatrician and epidemiologist and the mother to four children in the school and teenage years. I am passionate about the systems that support and sometimes hinder the health and wellness of children and their families. I'm honored to be here with you today to discuss the impact of parental stressors on the mental and emotional well-being of parents and caregivers, and in turn on their children and families. As healthcare providers, you inherently understand how deeply connected these issues are and are in place to act directly to protect parental mental health and help families flourish. Next slide, please. This is disclosures by way of housekeeping. Next slide, please. Let's take a few minutes to ground ourselves in today's learning objectives. First, we'll look at the current landscape of parent and guardian mental health and explore some specific stressors affecting caregivers and consider how these challenges ripple across families. We'll briefly touch on the relationship between parental stress and mental health conditions and challenges. And finally, Heather will take over to focus on realistic, patient centered strategies and tools that providers can use to support parents and the children they care for. Next slide, please. To ensure we're aligned in our discussion, I'm going to clarify some key terms. These are not the only definitions of these terms, and depending on your role and experience, they may not be your favorite, but they line up with those identified by the U.S. Surgeon General's advisory and provide a framework for a shared vocabulary today. Parents and guardians. The specific definition of a parent or caregiver varies across different research studies, and the term guardian typically further denotes legal responsibility. Today, I'll use the terms broadly, inclusively, to consider an individual taking care of a child under the age of 18. Biological, step, adoptive, grandparents, another family member, or even a family friend. Children, more straightforward. Today, we're considering individuals under the age of 18. Next slide, please. Stress, a state of worry or mental tension caused by a difficult situation. Stress can be acute, episodic, or chronic. Stressors can be internal or external, and a person does not need to be cognitively aware of that tension to be affected by it. Stress is an interactive process where environmental or physical demands trigger a physiologic reaction, activating the autonomic nervous system. The response can be helpful. Think of the surge of adrenaline when a parent races to scoop up a toddler running towards a busy street. It can also be harmful, particularly episodic or chronic activation of the system and the resulting elevated cortisol levels associated with hypertension, mood change, and immune system suppression. Mental health conditions. Diagnosable disorders affecting thinking, mood, and behavior. Here we're into the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. These have specific symptoms and may have criteria associated. Examples are depressive disorders, anxiety disorders, bipolar disorders, or schizophrenia spectrum disorders. We'll touch on some of these briefly, but the diagnosis and treatment of caregivers with specific mental health conditions is beyond the scope of today's discussion. Mental health challenges. Experiences or difficulties parents or caregivers may face which can affect their mental or emotional health without necessarily rising to the level of a diagnosable condition. Parental and caregiver mental health and emotional health exists on a continuum, one that is tied to their environment and their physical health, and in many cases, their personal histories. For the sake of focus and brevity today, I'm going to largely focus on the parental and caregiver stress, the kind that no parent or child caregiver completely avoids. Next slide, please. Without further prelude, let's talk about parental and caregiver stress. The state of being stressed is a person's interactive response to their environment. It's mediated by their personal history, physical health, and physical and social environment. How they cope with that stressed state may affect whether that state will lead to or exacerbate mental health challenges or mental health conditions. We tend to walk back to the very beginning and think of ways to reduce incidents that incite stress. but I'm going to encourage you to also recollect that improved coping and stress management skills can work to lower cortisol levels, mediating the negative effects of stress. In a healthcare interaction, you may not be able to reduce the stress in your patients' lives, but you can recognize it, acknowledge its importance to your patient's well-being, and act to empower your patients to be, well, less stressed by their stress. Next slide, please. According to the 2020 US Census Bureau, there are an estimated 63.1 million parents with children under the age of 18 living at home. This is actually a decline of about 3 million parents from the prior decade, related to a decline in birth rate and some to decreased rates of families living with their own minor children. A little over three-quarters of parents living with children were married. Another 7% were living with a cohabitating partner. Single parents account for 15% of all family living arrangements. This rate has doubled in the last 50 years, although it's remained fairly stable over the last decade. Being a parent or caregiver to a child is inherently stressful, and coping skills declined, with those reporting coping very well with the demands of raising children decreasing from 67.2% to 62.2%. A study in 2023 reported 33% of parents reported high levels of stress, compared to 20% of non-parents or non-child caregiver adults. Some of this data may be skewed by the COVID-19 public health emergency, with data collected between the fall of 2019 and well into 2023, affected by an extra layer of stress across the country. Next slide, please. Results from the American Psychological Association's 2023 Stress in America survey included the following findings. Parents were more likely than adults without children to report no one understands how stressed they feel, that most days their stress is completely overwhelming, that they're so stressed they feel numb, that stress makes it hard for them to focus, and a full 41% indicate that most days they're so stressed they can't function. Additional findings from the same survey indicate 66% of parents report they don't talk about stress because they don't want to burden others. This highlights the importance of asking, creating a safe space to listen, and acknowledging the stress that our parents and caregivers are experiencing. So, what are some primary stress triggers for parents? Next slide, please. Financial stress. Financial stressors are an important trigger with an established association with mental health challenges and conditions. According to a Brookings Institute 2022 analysis, the average cost to raise a child born in 2015 through the age of 17 was $310,000. More up-to-date data from LendingTree estimates that for a child born in 2023, that cost has climbed to $389,000 from 0 to 17 years of age. Yet the median household income in the United States in 2023 was just over $80,000. Further, only 26% of families have a stay-at-home parent, making the vast majority dependent on childcare in the early years, and childcare costs have grown by 26% in the last decade. In an American culture still often dominated by consumerism, this gives way to pressures not just for food and shelter and education, but for sports, shoes, clothes, and an array of electronics for older children. So perhaps it's not a surprise that financial strain and economic instability top the list of parental stressors. This may be acute, healthcare costs for a child hospitalized, but more often it represents a chronic stressor. 66% of parents in the APA survey reported feeling consumed by worries regarding money, and one quarter report there have been times in the last year when they could not afford basic needs, such as food, rent, or mortgage. Next slide, please. Time demands. There are 24 hours in a day, and that can feel very long or painfully short. But we don't all have the same experience in a 24-hour period. And for parents, time demands can be a significant source of chronic stress. According to the US Bureau of Labor Statistics in 2023, the average employment work hours for parents were 33 and a half hours a week. This represents a 28% increase for mothers since 1985 and a 4% increase for fathers. Married mothers with young children are a major driving force in this increase in work hours for women, with women's employment rate nearly doubling from 34.3% to 64.2% between the late 1970s and 2021, albeit peaking at about 73% of mothers with young children employed in 2000. Curiously, the amount of time parents spent with their children has also increased, including physical care, education related activities, reading to, and in general playing with children. In the late 1970s and early 80s, the United States was in its latchkey generation, but the prevailing trend today is being highly involved in children's lives. Since 1985, the time spent weekly on primary childcare has increased 40% among mothers and 154% among fathers. Add to this that nearly a quarter of all adults in the United States have a living parent age 65 or older, and they're supporting a child under the age of 18. More time at work, more time on childcare, time spent caring for aging family members. And it's no wonder that almost a quarter of all men and women report that they always feel rushed. This percentage of feeling rushed is higher for women, employed people, and parents, with working moms feeling the most pressed for time. Parental isolation and loneliness. Social isolation and a lack of social support can lead to heightened stress. A 2024 study done at Ohio State found that 66% of parents felt the demands of parenthood sometimes or frequently felt isolating or lonely. Nearly 2 in 5 felt they had no one to support them in their parenting role. Loneliness has been shown to affect physical and mental health, including cardiovascular disease, depression, anxiety, cognitive decline, and the immune system. Parental isolation can be intensely stressful. I can't tell you how many parents, especially those of young children, I've seen in the emergency room because the child was sweaty or pink or fussy or hadn't had a diaper in 24 hours. But they come in a panic, a normal fear or question about their child that had blown up in a moment of fatigue and loneliness, and sometimes helped along by an internet horror story, but feeling so alone and isolated that the emergency room was the way out. Cultural pressures in children's future. This one I'm well acquainted with. The social expectations, norms, and pressures to meet perceived parenting standards can contribute to stress. These are everywhere. Breastfeed, but not too long, but exclusively, but introduce solids early or they'll have allergies. Keep them home and safe, but send them to school early for enrichment. Time with family is most important, but engage them in many sports and activities for academic and social success. Have a job to show your kids the example of a strong working parent and, frankly, to make ends meet, but never be late for pickup and don't miss a ball game. There's a sense the world is reshaping at a rapid pace and concern about preparing children for a future that is difficult to anticipate. There is an expectation around children achievement that is almost impossible to meet, and a concern about community violence that makes parents want to keep kids close. Regardless of if you feel that parents sometimes bring these pressures on themselves, the reality is parents feel the stress of the pressures. The more fatigued, the more under resourced, the more isolated and lonely, the harder it is to find the inner strength to recognize these peer pressures for what they are. The stress is real, the cortisol is real, the health risks are real. Next slide, please. Children's health. For some families, health challenges of children may lead to increased stress for parents and caregivers. Parents and caregivers of children with intellectual and developmental disabilities face significant stressors to caregiving, and these parents and caregivers have increased reported symptoms of anxiety and depression compared to parents and caregivers of children without intellectual or developmental disabilities. In the United States, nearly 1/5 of all children under 18 have a special healthcare need, with 3 of the top 7 needs most often reported being behavioral health special needs. A third of children with special health needs require at home or coordinated care at least once a week, and 28% of these have a family member who is providing some or all of that care. Having a child with a disability or a special health need may bring pressures to learn specialized skills, increased financial pressures, increased childcare needs. An additional significant stress is the need to navigate complex systems of services to support their children, to become an expert in their condition, their managed care organization, available mental health resources, school services available, medications, feeding schedules, DME, and the never ending need to advocate for their child. Even for non-special needs children, parents' concerns about children's mental health has become more focused since the COVID-19 pandemic and the ensuing periods of isolation and disruption. Nearly three-quarters of parents are somewhat or extremely worried that their child will struggle with anxiety or depression. And while for many of you today the vocabulary feels natural, For many non-medical parents, this is a maze of front desks, receptionists, forms, acronyms, and referrals, and waiting. It is stressful, frustrating, and infuriating. And having a primary care physician, a care coordinator, or a provider to act as an advocate can be a saving grace. Next slide, please. Parents express concerns about children's safety, including worries about their children being bullied, kidnapped, or abducted, getting beaten up or attacked, or having problems with drugs or alcohol. Only 1 in 5 kids between the ages of 12 and 18 report being bullied every year, and the rates are worse since the pandemic, about 14% higher than just 5 years ago. The risk of bullying is higher in the middle school years, and cyberbullying is increasing, with twice as many girls as boys reported being bullied online. Being kidnapped by a stranger remains thankfully rare. Odds are only about 1 in 1 million. But if you include family abductions, where the child is taken by a non custodial family member, and runaway children, the numbers of children who go missing begin to climb. It's difficult to quantify children getting beaten up or attacked, but even if we limit to high school, about 8% of high schoolers reported being in a physical fight on school property in 2021. And in 2022, 61% of schools reported at least one physical attack or fight without a weapon among children. In some areas, community violence is concern enough that parents keep their children indoors after school. Teen substance use rates have been declining since about 2000, and so far have remained steady, although perhaps declining according to the most recent data in recent years. This is defying a concern that they would rise again post pandemic. Still, in 2023, 8.7% of American eighth graders reported having tried an illicit drug, and by the time they're in the 12th grade, that's climbed to 46%, although still almost half of what it was in 2000. And 2022 marked the year that firearm deaths climbed above motor vehicle accidents to become the leading cause of death for children 1 to 19 years of age. Despite that the majority of firearm injuries occur to children unintentionally and in private residences, parental stress rises with school safety after a prominent mass shooting, with 3/4 of parents reporting that a possibility of a school shooting is a source of stress. Next slide, please. Parent and caregiver stress is heavily influenced by specific family situation. 25 to 30% of families with children under the age of 18 identify as single parent households. Another 16% are blended, living with a step parent, step sibling, or half sibling. And about 18% of families in the United States in 2021 were multi generational, meaning 2 generations of adults old, over the age of 25 under the same roof. And that number's climbed fourfold since 1971. Other family structures can include foster families, cohabitating partner families, same sex and non binary parent families, and others. Each unique family may present opportunities or challenges to mental health. And depending on the family dynamics, these structures may increase stress or be protective against chronic stress. Family structure disruption is common from divorce or separation, but on about any given day, 7% of children in the United States have a parent who is incarcerated. Involvement with child welfare services, while an important service I'm intensely grateful, are very stressful for families to navigate. Before they turn 18 years of age, nearly 38% of all children will be subject to a CPS investigation. And an issue exceedingly pertinent in the last weeks is the family disruption due to immigration policies and the fear and stress families are experiencing, in some cases avoiding schools or healthcare settings completely, in the setting of increased federal immigration rates. And this isn't rare. Estimates are that 8% or 5.6 million children in the United States have at least one undocumented parent. When biological or adoptive parents are not available, primary caregiving may fall to a grandparent, other relative, or a friend. These scenarios can be beneficial for both the child and the adult, but the stressors of caregiving are transferred to the responsible adult. Next slide, please. Nearly 70% of parents say that parenting is now more difficult than it was 20 years ago, when children's use of technology and social media is cited as the top reasons. A majority of parents of adolescents report they are somewhat, very, or extremely worried that their child's use of social media could lead to major problems with anxiety or depression, lower self esteem, being harassed or bullied by others, or feeling pressured to act in certain ways, and with exposure to explicit content. But I found the first statement both more curious and telling. Nearly 70% of parents say parenting is more difficult now than it was 20 years ago. I'm suspicious if you asked parents 20 years ago the same question, they might give you the same answer, as would their parents before them, and so on. 100 years ago, families were large, and 14% of all children did not live past their fifth birthday. The risks were infectious disease, pneumonia, influenza, tuberculosis, diarrheal disease, scarlet fever. Most parents today think that a dose of pink amoxicillin is run of the mill for a childhood illness. But penicillin wasn't even widely available until 1945. Before that, there was symptomatic care, hope, and a lot of stress. Adults alive today, some will still remember stressed out parents clearing the cities in summer to avoid polio. Families in the last 100 years have survived the economic strains of the Great Depression, the Dust Bowl, the Second World War, the Great Recession. There was stress being a parent of a child creeping up on draft age during the Vietnam War, or raising a child during the Civil Rights Movement, or the height of the Cold War. Stressors are not new, but for most families, the stressors of today are close to home and can't be seen in hindsight yet. They know they're tired, stretched on resources, scared, and feel alone. What we know now is that this stress state puts them and their children at risk for poor physical and mental health outcomes. And we know it's important to inquire, acknowledge, and talk about parental stress. Next slide, please. Parental mental health could likely be a semester long course, and the specific diagnosis and treatment of mental health conditions in parents or otherwise is beyond the scope of this conversation. But I do want to take a moment to address the continuum. The etiology of mental health challenges and conditions are multifactorial: environmental exposures, family of origin stories, neurochemical factors, genetics, epigenetics, hormonal fluctuations, and individual variations in ability to cope with stress can all play a role. A 2024 survey from the Center of Behavioral Health Statistics and Quality indicated that 23.9% of parents had a mental health condition and 5.7% of parents had a serious mental illness. Further mental health conditions disproportionately affect groups of parents and caregivers, those with exposure to violence, poverty, racism, or social discrimination, and those who are just as involved may have increased stress exposure. Caregivers or parents with mental health challenges may have less robust stress coping skills, and chronic stress can play a significant role in the onset of psychiatric conditions, including major depressive disorder, bipolar disorder, and post traumatic stress disorder. If we think of each person, including parents and caregivers, as having an environmental stress threshold beyond which mental health challenges or conditions may be more likely to manifest, we can recognize the importance of proactively addressing parental and caregiver stress as a preventive health measure against sequelae. Understanding how mental health challenges experienced by parents may manifest differently based on gender or the family structure can help providers recognize and tailor effective supports. Next slide, please. Two broad populations I want to address today are mothers or female caregivers and fathers or male caregivers. These are broad strokes, and unique family structures will dictate applicability. Maternal mental health. Women have a higher prevalence of mental health conditions than men, 26.4% of women versus 19.7% of men. And the most common mental health condition among women overall is depression, but among mothers, perinatal period is important. Postpartum depressive symptoms affect 1 in 8 mothers, and contrary to the 6 weeks of grace we give ourselves postpartum, these symptoms can occur anytime in the first year after giving birth. Maternal mortality is a public health emergency in the United States right now, and there is heavy focus on hypertensive disorders, infection, and hemorrhage. But the leading cause of maternal mortality between 2017 and 2019 was mental health related conditions at 23%, especially in the postpartum period. Past history of a mental health condition, the experience of discrimination or poor social supports, and other high stressors can contribute to vulnerability. If you only remember a single point from today, I'm okay if this is it. Mental health issues are the leading cause of maternal morbidity in the United States, and they often occur in the 12 months postpartum. Having a child is a fairly obvious event. If you come across women with infants, screen them, acknowledge their stressors, make a safety plan if indicated, and have a low threshold to provide supports and resources. And for the pediatricians in the audience, even when the focus is baby, Spare a moment to screen mom and give her the space and permission to say, I need help. Next slide, please. And the gentleman, a much less well-studied group, but with increasing visibility on paternal mental health. Well, the focus has been on paternal perinatal depression, which may occur in 8 to 14% of men at some point during their partner's pregnancy or infancy. Paternal perinatal anxiety is actually more prevalent, affecting up to 18% of men in the same period. And a longitudinal study found that fathers living in the same home with their children had increased depressive symptoms in the first 5 years of life. And recall that in men, depression may be expressed more through anger, irritability, or aggression rather than sadness. The message may be more about family structure and dynamic. No man or woman is an island. Whether it's mom, dad, grandpa, or a non relative who's the primary caretaker, screening for mental health history, symptoms, and stressors are crucial for tailoring resources and support. Next slide, please. Parental mental health can influence the environment of caregiving at home that is crucial to a child's development. Children of parents experiencing mental health conditions, even those experienced before the child is born, are at higher risk for developmental, behavioral, and mental health issues. And adverse childhood experiences are linked to worse physical, mental, and behavioral health outcomes for a child. A 2019 study noted that maternal distress, including stress, life events, depression, and anxiety during the prenatal period, was associated with the child's increased future risk of mental health conditions. And using data from the National Survey of Children's Health, a 2021 study found children of parents with mental health conditions were twice as likely to have mental, behavioral, or developmental disorders and 4 times more likely to have poor general health. Parental mental health conditions are associated with increased healthcare costs and reduced economic productivity. This can exacerbate financial strain, stability, and the social bonds, leading to a cycle of further exacerbation. However, how a caregiver's mental health affects their caregiving behaviors is a critical factor in determining how it impacts the child. If the child's sense of safety, stability, support, and bonding with the parent or caregiver are not disrupted, sequelae can be mitigated, and having at least one non-affected parent or caregiver can diminish effects. The experience of parental and caregiver stress can alter the risk of mental health challenges and mental health conditions of parents, which in turn affect the physical and mental health of their children. Parental stressors can be mitigated by protective factors like social support networks and improved coping strategies. Looking for, identifying, acknowledging, and addressing parental stressors and mental health challenges is critical for the well being of families and children. I'm going to pass the baton to Heather Martinez to discuss prevention and care considerations.
Thank you, Dr. Canfield. Next slide, please. So, what can healthcare providers do to help prevent, identify, treat, and connect families to the appropriate mental health services and supports? We can start by prioritizing preventive care. Educating and sharing the value of preventive care is critical because this helps families understand that wellness checkups help prevent or delay the onset of mental and physical health conditions. It is during these visits that providers can address potential health concerns early, which can lead to better overall health outcomes. For our children, this also helps establish healthy habits to prioritize and promote wellness so that our families can be as healthy as possible for as long as possible. Healthcare providers can create a safe space during pediatric and well-check visits to educate families about the importance of mental health, stress management, and sleep. This is also a great opportunity to screen parents for mental health concerns, including parental stress and postpartum depression. Providers can routinely screen parents and inform them that everyone gets screened and receives mental health education, as it is part of providing holistic care. So let's put this into practice. When parents take their babies in for a preventive checkup, whether it be a newborn, 2 week, 6-month checkup, providers can carve out time to check in with caregivers to assess their mental health. It is important to stress how common mental health conditions are during this time and that they are very treatable. Caregivers can be screened for depression or anxiety using validated screening tools such as the Patient Health Questionnaire, the PHQ-9 that screens for depression, or the Generalized Anxiety Disorder Scale, the GAD-7, that are quick and self-administered. In the state of Texas, if a birthing mom is screened for postpartum depression using the Edinburgh Postnatal Depression Screening, or EPDS, or the PHQ-9, the provider can report the appropriate procedure code that corresponds to the screening results under the baby's well-check visit. Now, I want to stress that screening alone is not enough, and in fact, it can cause more harm than good if the screening is completed without discussion and action based on the results. This can create mistrust within the patient-provider relationship and lead to poor health outcomes. If the screening is positive for a mental health condition, be prepared to discuss treatment options and provide referrals to help meet the caregiver's needs. Establishing connections and relationships with mental health professionals and resources are critical, as this can help link caregivers to the appropriate services and supports. And if a referral is made, closing the loop is necessary because it helps ensure patient safety, improve care coordination, and enhance patient outcomes. Preventive care checkups are also a perfect time to bring awareness and discuss the connection between physical and mental health and how they influence each other. Those who are diagnosed with a mental illness such as schizophrenia, bipolar disorder, and depression often experience higher rates of obesity, diabetes, hypertension, and other metabolic conditions. Conversely, a physical health problem can trigger or worsen mental health issues. The key is that mental health is physical health, and an interdisciplinary approach to treatment is essential because it allows for a more comprehensive and holistic approach to patient care. For instance, a school nurse may identify a child that complains of frequent headaches. The nurse also notes that the child appears to get headaches when they take an exam. Psychological factors can play a significant role in headache development and frequency. Stress and anxiety are common triggers for headaches in children. Depression can also manifest with physical symptoms such as headaches. A consultation with a mental health professional is recommended to help identify the underlying condition and discuss interventions such as exploring potential triggers and encouraging healthy habits, such as, are they getting enough sleep and physical activity? Do they have a balanced diet? Many states have free access networks, which are state-funded programs that can offer consultations, referrals, and more. In the state of Texas, clinicians who provide care to youth and adolescents, including the school nurse, can contact the Child Psychiatry Access Network, or CPAN, to receive a free patient care consultation from a mental health clinician. CPAN can help connect the family and child to the appropriate mental health services and provide education and resources. Similarly, OBGYNs, pediatricians, PCPs, midwives, and nurses can access the Perinatal Psychiatry Access Network, or PeriPAN, for patient consultations, resources, and education for women during and after pregnancy. These programs help to expand the access to quality mental health care. Additionally, this increases the perinatal provider's capacity to treat more complex illnesses over time and provide comprehensive care. The perinatal provider may be able to manage a patient with mental health conditions throughout their pregnancy with the support of PeriPAN. As Dr. Canfield stated, mental health needs are the leading underlying cause of pregnancy-related death in the United States, and this is one way that healthcare providers can make an impact. Next slide, please. The demands of a parent are never-ending and include physical, emotional, and financial responsibilities, along with dozens more, all of which can lead to stress and burnout. Normalizing these feelings around parenting can be beneficial and can allow parents to recognize that it is a common and understandable experience, rather than a sign of inadequacy. It can help encourage parents to seek support and reduce feelings of isolation. Teaching our families to take proactive steps to prevent stress can significantly benefit parents by improving their overall well-being, strengthening family relationships, and enhancing their ability to effectively parent. By prioritizing self-care and managing stressors, parents can meet their needs and the needs of their children. They can reduce the risk of mental health issues and create a positive and stable environment for their children. If left untreated, mental health conditions can lead to negative outcomes for both children and parents, including lower academic achievement, poor health outcomes, and greater family conflict. Preventing or reducing stress is important because it has a significant impact on both the parents and the children's well-being. Long-term stress can negatively impact a parent's physical and mental health and make it more challenging to be an effective caregiver. Next slide, please. Providers can offer helpful tips at each touchpoint or provide specific guidance based on the caregiver's unique needs. Discussing practical self-reduction strategies with parents can make an impact on how caregivers perceive and manage stress. Sometimes small changes make a huge impact. Providers can begin by offering gentle reminders and reassurance that it's okay to talk about their feelings, especially around burnout. This can foster a more positive and emotionally healthy environment for caregivers and their families, and help establish a strong rapport between the caregiver and provider. Positive reframing is another powerful mental health strategy that can help caregivers manage stress by changing their perspective, cultivating a positive mindset, and building resilience. By consciously reframing thoughts and experiences, caregivers can reduce stress, enhance their well-being, and provide better care for their loved ones. Sharing the caregiver load with family members can significantly reduce caregiver stress by distributing responsibilities, offering emotional support, and providing respite. This can help prevent burnout and allow caregivers to focus on their own health and other needs. Additionally, it can promote a healthier, more balanced family environment. Gaining new parenting skills can increase confidence and self-efficacy. Skills such as fostering open communication, setting clear boundaries, and practicing empathy can help reduce stress. It's also never too late to learn new parenting skills. Taking breaks is also crucial for caregivers to manage stress, as those breaks allow them to rest, recharge, and attend to their own needs. These breaks can prevent burnout, improve patience and empathy, and reduce feelings of isolation. Similarly, recognizing and focusing on the meaningful aspects of parenting can help caregivers shift their perspective and foster positive emotions and interactions. This shift, along with incorporating strategies for stress management, can create a more balanced and fulfilling experience for caregivers, while also benefiting their children's development and well-being. Continuing to offer these recommendations can arm caregivers with tools that help them navigate the daily challenges of being a caregiver. Next slide, please. We've talked about how physical health and behavioral health are interconnected and how they influence each other. This connection requires a coordinated approach to patient care. One way healthcare providers can promote collaboration is with mental health professionals through behavioral health consultations and telehealth services. Caregivers can discuss their symptoms with a behavioral health specialist, and the behavioral health specialist can work together with the PCP or other clinician to provide referrals for treatment. They can also discuss medications based on the member's needs. By collaborating, healthcare professionals can provide comprehensive, holistic care to promote a more positive patient experience. Whether you are new to collaboration or you are continuing to collaborate with behavioral health specialists, it's critical that we educate and encourage the coordination of care to support the needs of the patient. Telehealth services can offer an increased level of comfort and convenience for patients. Being able to access virtual individual or group therapy sessions, support groups, or virtual intensive outpatient services from the privacy of their home allows patients to feel more relaxed and open during appointments. Telehealth services increase access to care and improve the delivery of mental health care. These services can help reach underserved communities, help eliminate obstacles such as travel time, transportation, time away from work or school, and the need for childcare. The convenience and flexibility of telehealth services can increase the utilization of mental health services and lead to more consistent treatment experiences. Professionals from various fields can collaborate to address the unique needs of each patient and develop comprehensive and tailored care plans that help reduce hospitalizations, emergency room visits, and the need for specialized mental health services. Next slide, please. When screening caregivers for mental health conditions, it's important to consider several key principles to help build trust, reduce anxiety, and promote a positive experience. Healthcare professionals should be aware of how cultural characteristics might influence the caregiver's openness to sharing information or affect the assessment process. Cultural awareness and sensitivity are essential for effective and ethical assessments. Additionally, adopting a trauma-informed approach can help promote safety, trust, and empowerment. Providers can begin the process by reassuring patients that you want to help. Make it conversational and normalize how common parental stress is and how it can impact both physical and mental health. Share that this is a difficult conversation and others struggle with it. Update workflows if necessary, and inform them that you screen all caregivers because mental health is important. Treatment options are available, and early identification leads to better health outcomes. Inform the parent about what information will be collected, how it will be used, and who it will be shared with. Gather information about their history, current struggles, and family dynamics. Discuss safety and identify a plan if needed to provide a structured approach to managing potential risks and crises. Initiating conversations around parental mental health early can help prepare parents for what to expect. Perinatal providers can address mental health during each prenatal visit and begin discussing the importance of self-care. Providers can remind patients that they will be asking about their mental health because it's important for the parents, the baby, and the family. Next slide, please. In an effort to make the greatest impact and reach, caregivers can be screened in a variety of settings and by various providers. That can range from pediatricians, PCPs, OBGYNs, NICU and emergency room staff, school nurses, therapists, and more. Primary care providers are often the first point of contact for individuals concerned about their mental health. There are several universal, validated screening tools that can be quick to administer and interpret. For example, the Edinburgh Postnatal Depression Scale, or EPDS, is used to screen pregnant and postpartum individuals for perinatal depression. Something to keep in mind is that the EPDS is a screening tool, not a diagnostic test, and it helps to identify individuals who may need further evaluation by a clinician. There are 10 questions with a total score of 30, and a score of 10 or higher warrants further assessment. Special attention should be paid to the last question that addresses suicidal thoughts. A score of 1 or greater on this question requires immediate evaluation to ensure the safety of the individual and their children. The CAGE questionnaires are used to screen for potential alcohol and substance use disorders. CAGE is an acronym derived from the keywords in each question that includes cut down, annoyed, guilty, and eye-opener. It has 4 questions, and a score of 2 or more on either screening is an indicator that additional assessment is needed to determine the extent and nature of any alcohol and/or substance use issues. The GAD-2 is a 2-question screening tool used to assess the likelihood of generalized anxiety disorder and other anxiety disorders. It is quick and easy to administer. Each question is rated on a scale from 0 to 3, and a score of 3 or higher is often used as a threshold for further evaluation. The GAD-7 consists of 7 questions, and a higher score indicates greater anxiety. Scores of 10 or higher suggest the need for additional assessment. The PHQ-2 is a brief 2-item depression screener, leading to the PHQ-9 if positive. Each question is scored from 0 to 3. A score of 3 or more generally is a threshold for follow-up. The PHQ-9 provides a more comprehensive assessment of depression and aids in diagnoses and monitoring of the severity of depression. The PHQ-15 focuses on assessing the severity of somatic symptoms such as pain, fatigue, shortness of breath, which can be related to mental health conditions such as depression or anxiety. Each symptom is rated on a scale of 0 to 2, with a total score ranging from 0 to 30. Clinical judgment is essential in interpreting scores with all screenings, as there are factors to consider that could influence results, including language barriers, fear of consequences, and individual differences in emotional expression. Repeated testing can also help to monitor progress or any changes. Results can help mental health professionals develop personalized treatment plans tailored to the individual's unique needs. To summarize, mental health screenings are a proactive approach to mental well-being, aiming to identify potential issues early, facilitate timely interventions, and ultimately improve outcomes. Next slide, please. As screening tools are completed, it's important to include them as part of the primary diagnosis and documentation. It's also helpful for monitoring progress and any changes. The screening should remain part of the patient record for documentation purposes. By having a clear record of screenings, clinicians can track progress, identify areas needing attention, and make informed decisions about treatment strategies. Again, pediatricians can screen both parents and caregivers during well-child visits and/or sick visits. This could be especially important for caregivers who are caring for a child with special healthcare needs. Taking the time to check in with caregivers and having a conversation about parental stress can be a gentle reminder that they must take care of themselves, both mentally and physically, in order to effectively care for their children and loved ones. Providers can also leverage ancillary staff to ask questions and observe dynamics while families are in the waiting room or in a patient room. The American Academy of Pediatrics and Bright Futures recommends screening for maternal postpartum depression during each child well visit from 1 month through 6 months. Screenings can also continue through age 21. The American College of Obstetricians and Gynecologists, or ACOG, recommends that women be screened for perinatal depression at least 3 times during the perinatal period. This includes screening at the initial prenatal visit and then again later in pregnancy, and then during the postpartum period. After screening and interpreting the results, again, be prepared to provide referrals and resources if services are needed. Educate caregivers on the importance of receiving mental health care services and supports, and encouraging ongoing follow-up and communication, especially if the services are not meeting the member's needs. Next slide, please. Access to medication and medication adherence are also critical topics to discuss with caregivers. Inform caregivers about potential medical side effects. The importance of taking medications as prescribed, specifically medications for mental health conditions. This means following the prescribed dosage, schedule, and duration of treatment. Consistent compliance can help the member long-term. For example, it is recommended that children who are prescribed ADHD medications continue taking their medications as prescribed, even during summer months and winter breaks, to manage symptoms and promote positive outcomes. ADHD symptoms such as inattention and impulsivity can affect children in all areas of life, not just during school hours. Discontinuing medications can impact summer activities and social interactions. It is also essential to address parental concerns and educate parents on how antidepressants work. This can help them feel more comfortable with the medication and any adjustments. Encouraging open communication and questions can help build rapport between healthcare providers and parents. This can also increase parental confidence in managing medications. Non-adherence can lead to worsening of the child's condition and can impact the child's quality of life by potentially affecting school attendance and daily activities. It can also increase the risk for relapse and hospitalizations, which can lead to financial strain. Next slide, please. Amongst other stressors, many parents are concerned about the impact of social media on kids. Providers can offer support by offering parents and guiding parents with the tools and knowledge to foster healthy social media habits in their children through education, communication, and modeling. This includes establishing clear rules, promoting digital literacy, and encouraging open dialogue about online experiences. Balancing screen time with physical activity, social interaction, and sleep are also helpful tips to share with parents. It's important that they pay close attention to the amount of sleep their children get and whether they have healthy relationships. If there's a decline in school performance or shifts in behavior, they should assess social media usage. Providers can ask parents about media usage at home during routine appointments and inform them that usage can sometimes mask mental health symptoms or other physical concerns. Parents should be encouraged to set healthy, age-appropriate limits for social media usage based on current clinical guidelines. Resources and pointers on what to look out for can help support healthy social media use. Next slide, please. Additional parental stressors around social determinants of health influence mental health outcomes and contribute to disparities. Family or community violence, poverty, racism, discrimination are a few factors that significantly increase the risk for mental health conditions for families. Providers can help by screening patients and families to assess for social needs that impact their overall health. Referrals to community-based organizations can help provide need-based resources. Additionally, providers can refer families to case management or care coordination if it is available through their patient's health insurance. Case managers can help coordinate care, provide patient and family education, link members to providers and resources, and provide wraparound care for the family. Many insurance companies also offer transportation to appointments. Other resources should be explored as well, such as employee assistance programs offered through employers, state resources, and resources available through local school districts and local mental health authorities. Addressing social determinants of health is vital for improving mental health outcomes and reducing disparities. Next slide, please. So once parents are screened and connected to services and supports, how can we keep them engaged and support follow-up care when we know that caregivers are challenged with barriers such as transportation, language and literacy, safe housing, low income, and limited access to providers, treatment, medications? Well, to begin with, providers can practice patient-centered care where the patient prioritizes their needs, their preferences, and their goals. A case manager or care coordinator can also provide ongoing support, coordinate care, provide reminders about follow-up care, and can assist with community-based resources and transportation. The use of telehealth services can provide access to care by offering flexible appointments and meeting the member where they are at. Follow-up care can be provided during preventive checkups, and providers can coordinate care with outpatient providers to reduce readmission rates and the need for higher levels of care. Education and support can be provided to ensure access to medications, stressing the importance of medication adherence, and encouraging communication with prescribing providers to ensure the best outcomes. Providers can also access electronic medical records and admission discharge transfer data to ensure that patients have follow-up appointments scheduled. Patients should be encouraged to keep their contact information up to date to ensure they receive all necessary information regarding their health. Additionally, providers can also offer parallel appointments to minimize travel and stress for caregivers who have multiple appointments for themselves and/or their loved ones. Next slide, please. We will close with some self-care considerations for families. Remind caregivers that informal or unpaid caregivers, either family members or friends, are the backbone of long-term care provided in people's homes. Respite care allows caregivers time off from their caregiving responsibilities. And despite the great sense of reward they may feel, caregiving can be challenging. Remind them to take consistent breaks from their caregiving responsibilities. To continue to be a good caregiver, they need to take care of themselves. Being a caregiver is hard work, and caregivers need care too. Next slide, please. We've included some national resources here, such as NAMI and the National Maternal Mental Health Hotline, along with some state-specific resources. Next slide, please. And here are some additional national resources. And then I believe the next two slides contain short videos that can be shared with your patients about prenatal and postpartum depression, quitting opioids, follow-up care after an ER visit or hospitalization. And I believe the next slide has some videos on mental health medications and substance use concerns. The QR codes can be shared in waiting rooms or added to patient education or discharge paperwork. And I believe that wraps up the presentation. I'll pass it back to you, Christy.
Great. Thank you so much, Heather and Dr. Canfield. Wonderful presentation today. Just going to keep it open for questions right now in the chat. But in the meantime, just wanted to let everyone know that if you will receive an email link within 24 hours from today's webinar with a link to the evaluation and the attestation so that you can receive your CME and CEU credit. Again, you should receive that in 24 hours after today's webinar. Also, if you would like a copy of today's slide deck, you can download a copy of that at the same site that you registered and you receive your CME and CEU credit. So I just see one question. I don't know, Dr. Canfield or Heather, either of you can take it, but what can an individual provider, such as a single case manager, do to assist with parents who are experiencing just exhaustion, especially when it feels like no other resources exist, excuse me. Okay.
We're not both jumping at it, huh?
Mm.
Um, Parents experiencing exhaustion.
Yeah.
So this is a common state. Some of it is normalizing it. Um, some of it is sometimes as small as giving a single moment back to the parents. And some of this has to do with listening to where they are and what's important to them, and sort of a little bit of a like a mini time study, right? How are they interacting with the child? What are the parts that they find exhausting? Sometimes what they find exhausting is it takes them 2 hours to put their children to bed at night. And so the exhaustion can be helped by empowering them to have better skills for bedtime. I sometimes hear from parents that the baby's crying, they have no time for themselves, they're exhausted, and it, sometimes it's giving them permission to say it's okay if the baby cries for 20 minutes. Like I don't want to hear that you haven't gone to the bathroom, or you haven't brushed your hair in a week, or you haven't done any of these self-care things because you're so focused on those children. So really reminding them of the importance of self-care. Um, in situations where, as Heather mentioned, where you have families who have um, special needs children or children with disabilities, or sometimes even young children, you can call in respite that isn't professional respite, right? Sometimes you need grandma to come and stay for a weekend, or a family friend, and having someone to even come for an hour and just sit, even if it's when the kids are napping or the kids are out, to just really be sure you've got your alone time. It can really take 10, 15, 20 minutes to just take a few deep breaths, walk around the block, and get yourself sorted to sort of get out of that exhaustion.
That's wonderful. Thank you so much, Dr. Canfield, for that. Let me just look here. Right. We're getting a lot of feedback of the excellent presentation today, very informative. So um, just thank you both again for today. If I know there were some questions about the CE website, so if you registered for today's webinar, that was at providereducation.com. That would be the same site that you registered for today. That's the same site you will receive a link to receive your evaluation and attestation and receive your credit there. Um, I think with that, we will close it up for today. And thank you again so much for your time.